How's it going, guys? It's Dr. Luo with Advanced Spine and Pain Center. Today we're going to be talking about compression fractures and kyphoplasty. So compression fracture is typically referring to a fracture within the vertebral body itself. So as you have fracture, the bone basically compressed down. So the main causes are thin bone / osteoporosis, tumor, and typically what it causes is a very single point pain somewhere in the back of the spine. That could in turn cause some of the pain related to muscle spasms in the back. So most of the treatment we have is through conservative treatment. So that includes anti-inflammatory medication, muscle relaxants, and sometimes opioids. And with bracing. So if you think about it, if you break a fracture of the hand, orthopedic surgeons typically brace the area. So same thing, we try to brace the area. But sometimes these compression fractures can be painful when you're sitting, when you're standing, when you're walking. As you move from side to side, some of the bone still move a little bit. So there's a procedure called the Kyphoplasty. What it does is that it injects some cement in there so your bone wouldn't move as much, and also restore some of the height that you have from the compression fracture. So if you ever wonder why sometimes older patients, as they age, they lose some height, it's typically from the compression fracture. So let's jump in and see what kyphoplasty looks like So this is a minimally invasive procedure. It takes about 30 minutes or an hour to perform. So typically the procedure is done with general anesthesia or with IV sedation. So once the patient is lying on the stomach, we usually prep the back, make sure everything's sterile and clean. So we first numb up the area where the skin is, and then after that we numb up deep inside around the bone. So the actual insertion trocar, which is this needle that's hollow on the inside, is pretty small. So we go through the area of the numb track and get to the bone, and then with intermittent x-ray pictures, we guide this into the vertebral body itself. Once we're in the vertebral body, we'll insert a balloon to kind of inflate an area. After that, we'll inject the cement in the area. Now, whilst we're injecting the cement, we go pretty slow. We try to verify the cement is not going to where it's not supposed to be. And typically this is done with the left side, and then we'll do this repeated on the right side as well. And after that, you should see cement filling up from both sides nicely into the vertebral body. So once this is done, you'll come back and go into the recovery room. We'll monitor you for about 15 minutes to 30 minutes. In terms of post-procedure incisional wound, it'll close up in a day or two. And I'm okay with you showering, but hold off on bath for at least 3 days. What are the side effects of the procedure? So in addition to pain, bleeding, infection, there are two unique things that could possibly happen in this procedure. So in terms of the cemented vertebral bone, that ends up being pretty strong. So the adjacent area, which is the level above and the level below, can sometimes subject it to more shear stress, and that can cause more compression fracture. The other complication that can happen is that the cement can go in the area that we don't want it to go. So if the cement goes in front and above, typically doesn't have any problems. If the cement goes posterior into the spinal canal, you can have area where it resembles a disc herniation, causing pinching and irritation at the nerve. Make sure you fast at least 8 hours if you're planning to have sedation or general anesthesia. In terms of regular medication, make sure you take most of your regular medication. The only thing we ask you to hold is your blood thinner, so we try not to cause any deep bleeding inside the spine itself. Alright, I hope that's all the questions you have. If you have additional questions, go ahead and leave a comment below. I'll try to get to it as best as I can.